Why is lung cancer so difficult to cure? Is it because we don't have the necessary drugs? It can't be, because every year new therapies are developed which can work very well with few side effects compared to normal chemotherapy. Imagine a patient diagnosed with lung cancer. His chances at surviving after 5 years are less than 20%. But he starts receiving treatment, and very soon the drug does a great job, and his tumor starts to shrink. For a few months, all he has to do is take a pill daily, and he lives a normal life. Then, one day, without any warning, the tumor starts to grow again, and the symptoms come back. The same drug that was prolonging his life now stops working, because the patient has become resistant to this drug. We really do not understand very well why this happens, but only if we understand the process completely, we will be able to reverse it. Now, what do we know already? We know that there is randomness involved. 2 lung cancer patients can be resistant to the same drug for very different reasons. But there is good news, and that is, for the few patients for whom we actually understand why they become resistant, we can continue to treat them, simply by giving them a different drug or drug combination. All we need to do is expand our understanding and cover all patients. This is what my PhD is trying to address. I want you to think about your media player. Your media player probably comes with an equalizer or with different knobs. When you want to quickly change the sound quality, you can adjust one of these components. Similarly, a cell in our body is a combination of proteins that have different functions. When a cell needs to quickly lower the levels of certain proteins, it uses some tiny molecules called microRNAs. In that sense, microRNAs are like protein volume knobs for our bodies. The problem is that very often in cancer cells, these microRNAs get out of control and start lowering the levels of proteins that they should normally leave alone. So, going back to our resistant patient, could it be that the lung cancer cells counteract the effects of the drug by increasing or lowering the levels of their microRNAs? To answer this question in the lab, I culture lung cancer cells in plastic tissues, and I turn their microRNAs up or down. Then I give them the same drug that is being given to patients, and after a few days, I observe to see whether they have died or survived the drug treatment. My PhD is being funded by Cancer Research UK, and we're trying to make observations that will help in new drugs that will keep these rogue microRNAs under control and hopefully help patients with lung cancer live for longer. Thank you.